Good evening, PCH Med Spa. Here we are with Nurse Kim.
Hi.
How are you? And Dr. K. How are
Hey
you,
guys.
Dr. K?
TikTok family, I came on again because a lot of you give us so much good feedback from all around the country, telling me how much these live TikTok sessions helped you make your decision for treatments and how much you learned. Okay, so I had a session this morning, mesotherapy versus laser, and we're gonna post that later on. But today we're doing a very unique treatment, and this is a very special treatment that utilizes CO2 gas that is infused under your skin, okay, using a tiny needle, and that stimulates the tissue to bring more blood flow and also help rejuvenate and restore your hair. Okay, so if you have thinning hair, not bald, but thinning hair, we also call it miniaturization. So when the hair is getting smaller, this is great, just like exercise for your body. Why? Because it will bring more nitric oxide and oxygen to the tissue. Think of it as a chemical acupuncture. So not only you stimulate the tissue with the needling, so it has the needling because you use a needle, right? But also chemically, it improves oxygenation and all the good things that comes with that, right? Any questions you have? Let us know. I never use numbing for this. I try to get a session every other week. Nurse Kim is very busy these days, so it's hard to find her free. But we try, and there's no numbing needed. Of course, you can come in and numb, but it's maybe 1 out of 10. I don't even care, you know. And there's no downtime with it. And guess what? When I go home, I have this exosome boosters that I put on and rub it in. Why? Because the skin is now open. It's got all these needles. The needle opens up the channel. So I also get a micro needling, not like a real micro needling, but just those tiny pokes that she's creating that will make my skin more receptive for growth factors, stem cells, exosome, salmon booster, if that's what you want to, you know, all of them do something. For the hair, a little pearl, the PRP or PRF, it doesn't do a lot for the hair. It does great for joints, okay? My background is a rheumatology doctor, and guess what I'm doing now in this time and period of my life? I'm a board certified internal medicine with rheumatology training in University of Miami a long time ago. So it works great for the joints, you know, when you put PRP or PRF with stem cell in the joints. It works relatively okay for the skin. That's vampire facial. Remember, Kim Kardashian talked about it years ago and was very popular. That's microneedling with PRP, right? It doesn't do very good for the hair, but, and I talk to, when I go to aesthetic shows and things like that, I talk to a lot of guys like Dr. Robert Dorfman, young guy, great guy that does only hair, right? It doesn't do great for the hair. We still sometimes include it in our package, but the exosome stem cells like wart jelly, exosomes, and salmon booster actually does better. Exosome, exo hair is my favorite. Now overseas they have all this hyaluronic acid, they do all this crazy shit. I don't think it's that effective. I never trash what other people do, because if you utilize it right, it does something. Unlike a lot of other doctors that I see, for example, I'll come back to Carboxy, but I saw this Iranian doctor tens of thousands of followers, 100,000 followers, all these likes, and he says, oh, Endolift is horrible because it melts the fat, and it's trashing one of the best treatments in the world for skin tightening, and I am the live proof. We built the practice around these kind of treatments. Just because you don't know how to utilize a machine, it doesn't mean you can trash it. And when you say that something like that on social media, you have 100,000 followers, and it goes to hundreds and hundreds thousands of people because it gets forwarded, right? You deprive a lot of people from one of the best treatments. Just an example. So I never trash a treatment. I just say one is better, one is not as good, you know? And always take it with grain of salt, because when the doctor is trashing a treatment that another doctor is doing and you're seeing the result, take it with grain of salt, because unfortunately it's a financially driven thing, you know. Some people want to do facelift, they say Sculptra is horrible, thread is horrible, Endolift is horrible, so forth. We never do that because we don't need. You guys know we do things right, and you know, we don't need to trash other doctors or other procedures. Back to Carboxy. So PRF doesn't do very good for the hair, okay? And these treatments really help really keep your scalp on its tiptoes, if you will. I also say that so my nurses and Suke learns, because these ladies, they're on the phone all day. They are the first barrier of patient, you know, I cannot answer the phone, right? So when they learn more, they can educate the people more, all right? And they can answer them better on the phone, right, Suke?
Correct.
Okay, Suke, any questions?
Let's see, no questions yet. Everyone's just watching
okay, anyone
us.
has questions, this is your chance. Hair restoration is not, you know, something we do every day, but we do it, and we are very proud of the program because we do collagen threads, great option. We do Carboxy, we do the boosters, we have some serums for hair. Dr. Lalanik's Dormix is one of the best booster sprays for the hair. It has minoxidil, finasteride. We do sometimes hormones for the hair, optimization. Oh yeah, we do the GHK-Cu copper peptide, right? The blue peptide. Mm-hmm. Nurse Kim does that for the hair, so she's really getting busier with that. We can do it daily. It's an injection, not in the scalp, but in your belly, right? You can do it daily, you can do it weekly, and that's about it. You can also inject it locally, but we don't do that. Any questions, you guys are welcome. Other than that, I'll have Nurse Kim, because she's the only one who does this procedure in a big miles radius in Orange County. So she will tell you a little pearls about Carboxy.
To add on to what Dr. K already mentioned, it is very, very easy, but you need to, if you want to start your treatment, you need to do a few sessions back to back. It has to be done weekly. So usually I recommend 3 to 5 sessions every week. It depends how thin your hair is and where you're standing. And then after you do maintenance session, as like once a month or every other month, you need to do 1 session to keep the results. It's very easy, no pain. You feel a little pressure. You can go back to do your normal activity right away. There is no contraindication right after.
No downtime,
No
exactly.
downtime.
Contraindication, none. It's very safe. And you're right, there's very few treatments that you can say it's very safe and there's no downtime and it can create results. And she's absolutely right. You have to do a bundle of sessions, 3, 4, 5, once a week is great, every other week is okay. And then you come once a month. There's a maintenance. A lot of things in aesthetics, unfortunately for us, is maintenance. You have to come every so often, you know. Endolift is a rare exception. That's the internal endoscopic facelift, because you do 1 session, right, Suke? And you're
Yes.
good for years, right?
Yes.
Like our Brazilian lady is an example. She's around maybe your age or even a little older, and I don't know how old you are, by the way, but she is maintaining,
Young.
right? You know, I'm talking about. When I saw her after 3 years, we did the collage because she comes every 2-3 months, and she's a friend of mine, so she followed up with me as a maintenance patient, right? And that's very uncommon to see one session and the results last for years. So maybe other treatments, like Morpheus 8 that Nurse Kim does. Show them the machine behind her, the Morpheus 8, right? The Morpheus 8. So she does 3 sessions, and that's good for 1 to 2 years potentially, right? Nurse Kim. Okay, back to you. So any other tips about Carboxy? Can you do a little bit more on back here?
Yes.
Yeah, I'll just go like that so it's easier access for you. And do a little zoom in so
Let's
people
just
can
show
see, yes.
the TikTok family, what Nurse Kim is doing to Dr. K.
She's keeping my hair alive.
After when you do your 3rd session, most of our clients, they see amazing results. Your hair gets noticeably thicker. Your hair shedding stops even after 1 session. Especially for the ladies, when you take shower and you see lots of hair falling down, after you do 1 session, you don't see that anymore. All of my patients say that's the first thing you notice, and then after your 3rd or 4th session, you start to see your hair getting thicker. Your baby hair is growing. It's very noticeable.
Very nice.
Yes.
Beautiful.
Okay.
So, do a little bit more back here. I have one more tip I want to tell people. Any questions, by the way?
This is called Carboxy, by the way, whoever is joining now. So.
Okay, yes. PCH Med Spa, Corona Del Mar, Newport Beach. This is Carboxy. I'm Dr. K. Suke is filming. This is Nurse Kim. We have a smaller family now. We are a small med spa where we do the biggest variety of treatments under a very small space. And we want to keep it that way because that's the only way you can keep quality. That naked MD place, crazy insanity. Tons of whatever staff they have, I don't care, but that quality of work is not good because you don't have control of what's happening. We keep it small, that's the only way. Not to trash them, but just an example. But one thing I wanted to tell you, I forgot, but the baby hair is very important, right? And it's difficult to maintain hair. Yes, I wanted to say it stops the shedding. Very important because some of these hair is not getting enough oxygen, and the follicle slowly dies. Everything happens very slowly with the hair, right? Therefore, that's what she said is very important because I've noticed that, the amount of hair loss slows down. So a lot of it could be also prevented, All my patients tell me I have more hair than 2 years ago or last time they saw me. They are right. I have more hair than 2016, which is 10 years ago, okay? So that's all thanks to hair. And, if you have thinning hair, first of all, we have to do a consult. This could be autoimmune, it could be hormonal, it could be many reasons. It could be male pattern alopecia, which is like an M up here, right? And I don't have that. I have a little thinning of the crown, which is not a typical, yes, that's also, a male pattern is usually like an M here. We do a lot of treatment for guys, and of course we might customize treatment for you. Lots of talking, guys. Thank you. And we will post this so you can comment and question below the post or DM us and give us our information, Suke. And
Once again, this is PCH Med Spa in Newport Beach, California. Call us to book your appointment for Carboxy.
how many minutes was this total? 10, 12?
10 minutes about,
So she
maybe.
did 10, 12 minutes on me. It's a quick session. All right. Adios. Ciao.
Bye.
Thank you, Nurse Kim. Thank you, Suke. Bye-bye.